Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today I'm delighted to be joined by Dr. Sajad Zalzala. He is the co-founder and medical director of Qualitude. He's a physician licensed in 50 states and currently living in the Detroit area. And he's very focused on functional and holistic medicine. Dr. Z, as you're known, thanks for joining me today.
Well, thank you very much for having me.
Help the listeners a little bit before we dive in. Tell us a little bit about how you got to this point of founding the company and your focus on longevity and this whole issue of aging. Tell us your journey.
Sure. So, like I said, thank you very much for having me here. So, I took a little bit of an unusual course through medical school or to medical school. I actually started out in the IT field. My first degree was computer science because I gravitated toward technology when I was in high school.
Man after my own heart, I have to say.
I used to tinker a lot with computers, taking them apart, building them back up together, and things like that. And so for me, in my mind, IT or computer science is kind of the perfect fit for me. But then, as I got more and more into the field, I found myself gravitating more towards helping patients with their problems rather than technology itself. I was never really good at programming, so I knew I'd never make it as a programmer. Programming language just never came natural to me. But what did come natural to me was troubleshooting. I was everywhere I went, it seemed like people were calling on me to help them troubleshoot issues. And so I came to realize that medicine was a better field for me. Because, like I said, I gravitated towards helping people and their problems, so I switched to a biology degree in college, and I took the courses for MCAT and things like that, and went into medical school. I didn't know what I was in for for medicine, but what I did find was there was a big disconnect between what we learned in terms of anatomy, physiology, biochemistry, and the therapies that were being taught to us. And so I became a little bit of disappointed in the conventional medical field. In fact, I was almost going to drop out of medical school were it not for an interview I heard on the radio by Ray Kurzweil. He had just come out with his new book called Fantastic Voyage, Live Long Enough to Live Forever. And I'd never heard of him before. I'd never really heard about, integrated medicine or functional medicine. I didn't even know what that was at the time. But, I finished up listening to his interview. And I went to my courses that day, and right afterwards, right after Borders, grabbed the book, kind of read it cover to cover, and then I found ways to kind of learn more about the field because that really clicked with me. And for those who are not familiar with the book, I mean, he co-wrote it with a medical doctor. They talk about, eventually we're gonna have the technology to upload our brains into a computer, and then live forever. Hence the subtitle. But until then, we need to be able to keep our body and our brain in good enough shape because if that technology is 50, 60 years, from now, and you're in your 40s or 50s, you're not going to make it. So, using conventional means. And so his whole book kind of focused on finding ways to stay healthy. And then that included, different types of diets, different types of foods to eat that have shown promise, different supplements. Back then he was kind of famous for taking, a whole bunch of, a little bowl full of supplements, and I think he still does that on a regular basis. Of course, the science has come a long way since he published that book almost 15 years ago. So that really got me started into kind of, I just kind of dove deep into learning everything I could about the field of holistic medicine, functional medicine. I attended, I read books, listened to podcasts, attended seminars and conferences and things like that. And then, after, I finished off residency, and after residency, I kind of went to private practice, where I still have a little bit of a private practice going on, but it's I've been looking kind of for ways, the best approach, the best way to kind of launch myself into the functional medicine, holistic medicine, longevity field.
Tell us a little bit about Qualitude and what it is for those
Sure.
that don't. We'll link to the webpage, but
Sure.
it's not entirely unique, but it is, at least different to some of the other players in this space.
Sure. Well, to kind of understand Qualitude, let me back up a little bit. So a few years ago, I was looking kind of to see what upcoming trends in the medical field, and telemedicine, really came onto my radar. And I started working with some of the telemedicine companies out there, and that's kind of what led me to get licensed in all 50 states, so I can become an asset to the field.
I just want to say that alone is like a Herculean task.
Yeah.
And you know that, right?
Yeah, apparently there's only about a dozen of us out there who are licensed in all 50 states, and it was a lot of work. But
right.
Anyway, so I started working with some of these telemedicine companies, and I saw their success, I wanted to kind of find a way to use the experience I had gained in with these telemedicine companies to try to kind of merge my passion for holistic medicine, longevity, with telemedicine. And a friend of mine reached out to me, and I had kind of pitched the idea to me. I had the same idea, just and so we sat together, and we came up with a plan. And that's how we end up with Qualitude.
And what is it? So tell us what Qualitude is.
Sure. So the basis of our service is to provide therapies for human longevity, prescription therapies for human longevity, and we started out with Metformin because there seems to be a lot of good data. There's a lot of good interest as well. Back in the summer, I believe, there was an article that came out about how Silicon Valley executives and venture capitalists were using Metformin kind of on the down low. Some of them didn't want to go on record. Some of them would, and some of them wouldn't go on record. And I'm like, well, I wonder how many other people out there are interested in taking Metformin based on the works of, there's a lot of good research out there on it. There's a lot of prominent researchers and physicians kind of taking it themselves. So that led me to realize that and there's a lot of anti-aging doctors, doctors who kind of have anti-aging clinics, and they prescribe Metformin as one of their tools to help patients kind of live healthier and longer. And I'm like, why does Metformin have to be just in these specialized anti-aging clinics? It's affordable, it's readily available. Why not introduce it in such a way so that anybody who reads the research or follows these prominent researchers or physicians, why can't we give them access to it the way that some of these telemedicine companies have given access to erectile dysfunction drugs or hair loss drugs or acne medications? Why not?
And to talk about those just a little bit, I think, historically people would have looked at some of those services as a little bit out there, gosh, should this really be a service that we offer?
Mm-hmm.
But now it's pretty much mainstream. I don't think anybody would sort of bat an eyelid. And what you're essentially offering here is a similar service, but in this instance, not just on longevity, but also on quality, right? This is, it's a little bit of a play on words. I know the QALYs is, adjusted life events, but in this instance, it's about quality of life as well, right?
Yeah. So the name Qualitude, QALY, is a medical economic term for quality adjusted life year. So one QALY is equal to kind of 1 year of perfect health. So,
and perfect being the operative word there, right?
Exactly. And then there's the opposite. There's flip side. There's the DALY, which is disability adjusted life here. So, so we wanted kind of to build a service, a platform for not only to provide access to these therapies, but also kind of get the conversation going and kind of reframe the discussion on healthcare. And instead of focusing on diseases, which is really sick care, not healthcare,
right?
We kind of wanted to we wanted to help reframe the discussion so that it becomes more and more common for more and more acceptable for patients to take therapies to help them live longer and healthier.
Right.
span rather than lifespan, just lifespan. So that's
So,
kind of
so
how we.
and you picked metformin, which for viewers that don't know, that's a drug that's used in the treatment of diabetes type 2 predominantly. But your patients don't have diabetes. Tell us a little bit. I mean, we'll link to some of the trials and the information in the accompanying post, but share a little bit of how you started on this and your thoughts around metformin as a possible treatment.
Sure. Well, like I said, the reason why we chose metformin is, like there was that article that indicated that, like I said, Silicon Valley executives
Demand, right?
yep, there was demand for it there, but also, it has it's been around for a long time. It's one of the oldest medications. The pharmaceutical medication. It's actually, a lot of people don't realize it's actually derived from French lilac.
Yeah.
It's not exactly the original molecule from the French lilac, but it's very similar to it.
It's goat rue or something, isn't it?
Yeah, I think that's the other name for it.
Yeah.
Doesn't sound as fancy as French lilac. But yeah, I mean,
French lilac, yes.
yeah, I mean, I think that's I personally believe that's part of the reason why it has such a good effect, because it's a naturally derived therapy. That doesn't necessarily mean that there won't be completely synthetic therapies out there that won't help. But it has a lot of effects on the human body. I mean, it helps reduce glucose levels. It encourages weight loss. Helps control appetite. But the way that we think it works for longevity is by activating the AMPK or AMPK pathway. That helps mimic calorie restriction. And for those who don't know, calorie restriction is really one of the most fundamental therapies for longevity. When you look at animal studies, even all the way down to yeast, when researchers want to extend life, calorie restriction seems to be the most reliable way to do it. But it's not easy for humans to do.
Right.
You can do it in lab animals because you weigh everything out, and you give them they're in a cage or they're in a closed setting. But when it comes to humans, there are people who do it, but it's just very, very difficult for people to do on a regular basis.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Dr. Z. He is the co-founder and medical director of Qualitude. He's also licensed in 50 states. We were just talking about metformin and some of the reasons, and you actually highlight something that's interesting, and anybody that tracks any of my activities will know that I'm a big fan of intermittent fasting, and
Right.
essentially metformin essentially mimics that, but it's in a pill, and that's very much one of the ways that we approach things in medicine is to try and find sort of replicants or reproducing those effects. So tell us a little bit about the safety. I mean, I think one of the things that struck me about this is that, long experience of use of this, both as a drug, but also as a supplement that people have used over the ages prior to the sort of creation of drugs. Is it safe? What are the sort of downsides of this, if there are any?
Sure. Well, it's as far as I'm concerned, it's one of the safest medications or even supplements, if you compare it to supplements out there. I mean, we have literally millions, if not billions, of patient life,
Right.
patient year experience with it, just massive amounts of data. And the vast majority of data indicate that there's really no major adverse effects. When you look at patients with diabetes, they're on it for years, decades.
Right. Yep.
And there doesn't seem to be any major issues. There is a list of side effects, just like any medication. You can kind of look that up. But the most common side effects that I see is gastrointestinal issues,
Right.
nausea, loose stools, sometimes stomach cramps. And there are different ways you can kind of get around that. It's more of a inconvenience than, I mean, some people, some people get a really bad response to it, but that seems to be few, probably less than 5% in my experience.
So, limited downside. I think there's historical evidence, but it's not Not to the point of proof, I think, at this point. You're sort of on the bleeding edge. I'm excited about the TAME trial that Nir
Mm-hmm.
Barzilai is sort of, hopefully we're going to get to the proof points. Tell us a little bit about, why start now before you've got proof points? I mean,
Sure.
what's the sort of justification for this?
Well, I mean, I don't think we're necessarily going to ever have enough proof to convince everybody about
We never
metformin.
do, right?
Right, exactly, exactly. I mean, look at aspirin, for example. I mean, it seems like we go back and forth. Should we take a baby
That's true.
aspirin for
Yep.
prevention? Some studies say it's the best thing in the world. Other studies say it's not worth the risk. For primary prevention anyway. Even things like that. There doesn't seem to be ever enough proof to satisfy everybody. But at some point, there's a cost to inaction as well. So a lot of people don't realize that. If you do nothing, then the aging process is going to take its natural course, and people will develop all sorts of terrible diseases and dysfunctions from the natural aging process.
Right.
So I think the key is here to kind of find a balance between therapies that are safe, relatively safe,
Mm-hmm.
and therapies that have enough proof to warrant prescribing them. And like I said, I don't think we're ever going to get to the day where we have like enough proof to satisfy everybody's demand.
I
But
think that's clear just with the vaccine movement.
right,
We've got proof, but that's not enough for some, and
right,
it's kind of tragic that.
sure.
So, accepting that to one side. So, metformin, obviously one of your first areas of
Hmm.
focus, but I know you've got some additional ones.
Hmm.
So, you haven't started yet, I think,
Sure.
to be clear. Tell us a little bit about the sort of next generation of this and where you see this going.
Sure, sure. So the next two therapies that we're looking to launch here are continuous glucose monitoring devices. It's not
Mm-hmm.
really a treatment per se,
Right.
but it kind of falls in line with the idea of using metformin to kind of keep your blood sugar. Well, one of the reasons metformin will help is it kind of keeps your blood sugar on the lower side. And again, increased blood sugar increases insulin, and that seems to have all sorts of negative effects on long-term health. So by providing these by prescribing these devices, it helps patients get enough data to make sure they're on the right track with their diet and lifestyle. That's, like I said, that's not really a treatment, but it is a prescription device.
Right. Yep.
You can't just go to Amazon and pick up one of these devices. It needs to be prescription. So I think that'll be a little bit less controversial because it's like I said, it's not a therapy, but it is.
To be clear, I think
Yeah.
not, because people get upset about monitoring and,
Yeah.
But I
Right.
agree with you. I don't know that everybody does, but
And then shortly we'll be launching NAD patches. NAD is a molecule that's kind of been, you learn about it in high school biology, and you forget as part of the Krebs cycle, and then you
Krebs
forget about it.
cycle, citric acid cycle.
Exactly, and then you forget about it. But
Right.
and for many years it was forgotten about. Until some research came along that showed that as you age, your NAD levels drop precipitously. And it's thought that the NAD is kind of the fuel for a lot of the anti-aging longevity genes and enzymes.
Right.
So, for example, without enough NAD levels, the sirtuin pathways don't work properly.
Right.
And that's part of the reason why we think resveratrol didn't take off as a therapy as much as we'd like to think for humans.
So just a point there for those listening when you hear resveratrol, that's the Red Wine Association.
Yeah.
Those of you that are drinking your red wine are anti-aging to drink red wine, right?
Right. Well, you'd have to drink a lot of red wine to get
I know, but I'm just helping
resveratrol.
people make the
Right.
connection.
Right. But as you age, I mean, I mean, not only do these sirtuins, they're called the SIRT1, SIRT2, and there's a whole family of SIRT, the SIRT genes collectively known as sirtuins. So these sirtuin genes kind of decrease in function, and part of the reason why we think this decrease in function is because of the drop in NAD levels.
Right.
As you age, it's probably a combination of increased demand as well as decreased synthesis, and so there's been a lot of work on this field. You have companies introducing NAD precursors taken orally. Nicotinamide riboside, also known as NR, and then there's another one called NMN. Please don't ask me to pronounce it.
And this, to be clear, from a physician, just so everybody knows, it's not just you.
Yeah, so NR and NMN are kind of oral precursors. So you kind of take them, they get absorbed, and then the idea is that they make their way into into synthesizing NAD. There's some thought that as you age, even that conversion, even taking the precursors, just doesn't necessarily cut it. You'd have to take quite a hefty dose, and that can become quite costly quite quickly.
Right. Yeah.
So I mean, there have been NAD IV therapies. A lot of clinics. Again, the anti-aging clinics have kind of come up with this idea of giving NAD directly through an infusion. Again, you have to go to a specialty clinic. It's very costly.
Right.
Half a day out of your time, half a day out of your schedule. Usually travel. So the next best thing we've discovered is NAD through a patch.
Right.
And it uses a technology called iontophoresis, a very low level electric charge to kind of drive this charge molecule. NAD is a charge molecule. That's why it's usually NAD plus. To indicate that it has a charge. So it works really well with this iontophoresis technology. And the patches are an FDA-cleared, FDA-approved device used usually for sports therapy, but we're kind of repurposing those for NAD. And really, you can use them for any charge therapy, whether it's dexamethasone, which is what it was originally designed for, or NAD, or really anything else out there that's suitable to use with. But preliminary data shows that using NAD patches on a regular basis boosts your NAD levels internally far greater than what you can get by taking these oral NAD boosters.
So some clear opportunities. We're running out of time, as we always do. I just wanted to maybe ask you for a couple of thoughts around this. And, let's take the non-controversial CGM, the continuous glucose monitors. Gosh, prescribe that. But one of the downsides to this is that tags you in the system as a diabetic or potentially pre-diabetic. And, any thoughts about that? And then if you could just finish off with where you think this is going and where the other opportunities for therapies around this, improvement and lengthening of life.
Sure. Well, I mean, there's always going to be that issue of people being quote unquote tagged as a diabetic, but like I said, we're kind of trying to reframe the discussion here, so it becomes more acceptable to use CGM and Metformin for people who are not. In the future, I think the excitement really lies in other therapies such as rapamycin and a class of drugs called senolytics. When we do launch those, it'll be under a clinical trial.
Right.
So that way, because not enough is known for their long-term safety yet. Very promising, but we hope to be involved in clinical trials, directly, and also through funding clinical trials from other organizations. So I think there's a lot of exciting things coming up. Metformin is just the tip of the iceberg.
It's fantastic. I'm so excited to hear this. I think an indication, and part of your journey and your steps to this was the response to a demand that people are seeing. I think that was the same with hair loss, erectile dysfunction, and all of these other things. You've sort of met that demand, but met it from a clinical standpoint and a scientific standpoint. Unfortunately, as usual, we've run out of time. It just remains for me to say, Dr. Z, thank you for joining me and sharing your insights. It's been a real privilege.
Well, thank you for having me and allowing me to spread the message.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com, and tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, The Incrementalist, and I'm starting a revolution through evolution.